so happy to have you here today with our clinical team, Veronica. As we were talking about earlier, we're neighbors. I think I could ride my bike to your house, which is pretty well. We're going to have to meet for coffee, or I don't drink coffee, but it sounds
You know,
good.
neither do I. So yes, happy to meet though.
There you go. But they have nice shops, and I'll get a lavender, I don't know, hot something, whatever. It'll be fun. But tell us a little bit about. I was so excited when I met you at ADC to hear about what you're doing to help people who might want to come home. If they're on dialysis, they want to come home, but they need help. And you're doing something really phenomenal with your company. So if you don't mind, tell us a little bit about you and your company, and what you're excited about.
Yeah, absolutely. Again, thank you, Kimberly. It's been an amazing, it was amazing meeting you there. Super high energy, and I love, the collaborations that you're a part of. And so, my name is Veronica. I'm the Chief Operating Officer of Herewith Inc., and we are a San Francisco health tech company. It actually started with the original vision of helping seniors stay in their home for care, but not having there's this huge disconnect as to where agencies can and cannot go, how they can get help, etc. There's just so many barriers right now to getting care. And as we know, seniors are there's not that support system like there used to be. So our app was developed to really make that connection. Think along the lines of Uber and Bumble, kind of merge into one. Bumble, they get to go on and you get to pick that perfect caregiver, and you can go through and you're getting. And one of the things that we've been phenomenal at doing is being able to provide a vast amount of helpers, is what our branded name is for our caregivers. They're called helpers, the Herewith helpers, and we have a lot on there. They come from all different versions of the community and backgrounds and education. And, we have everything from RNs that are retired who are just like, I really want to go out there and do things. We have seniors themselves who are a lot more physically capable than maybe their counterparts, who are looking to also do that companionship piece, go in and do puzzles, because we do have everything non-medical and down, which we know is huge, right? We can do hospice. We have people on there who have done hospice, memory care. We do the companionship, one-off tasks. If every Wednesday, grandma wants to go down and wants to play bingo, and the working world is the way it is now, us as daughters are not able to be off every single Wednesday to take her to bingo, or maybe we don't live in the same location. You go on the app, you punch in a couple of preferences, and you can go on there and you can pick somebody within your own community, because those are also helpers within the same community. So it's actually very beneficial for both ends. And if you don't like someone, don't pick them next time, and that's okay. You're not tied into a contract. We don't have the overhead that most facilities or agencies will have. Think along the lines of Comfort Keepers. They have an office. They're only within that specific amount of territory. And so if you get these rural places, you might not be able to go into the rural places. But then again, they also have the overhead where, you're paying as a family maybe $20 to $25 an hour. Quality isn't the best, or there's a lot of turnover, or not everybody can work the shifts that are imputed upon by agencies and facilities. 6 to 2, 2 to 10, 10 to 6 does not work for everybody. And I think we can think along the lines of parents. The school system is set up from 8 to 3, and you have to work 6 to 2. Well, what happens in those 2 hours? So then you end up not being able to have employment. And then what we realized was, this is actually really beneficial for a lot more people than just seniors themselves. We started getting RNs reaching out, being like, hey, I really would love to do this. Do you have anything for RNs? Do you have something that's more specialized? And we dove into dialysis as one of our verticals. And we have what's called our healthcare partnership verticals, where we also do dementia and hospice care. But dialysis kind of came out as one of the ones in need. And what we realized was these care partners, they're going into the facilities, they're doing the training. If Kimberly's my sister and I'm doing it with her, I'm this care partner, and Kimberly no longer needs me, we then have an entire sector of people who are trained, who are certified, and whose loved one is no longer there for them to care for. So we decided to start gathering those care partners up, because what is happening within the facility setting is one, you think along the lines of Davida and Fresenius, and you realize that the people in the facility, one, the facilities are overwhelmed, they're overworked, there's a lot of turnover. We know, and that's healthcare in general, we know that there is an issue. And we also know that patients thrive and do better if they are in that home setting. But as the way the world works now, not everybody has a care partner to be at home with them. Or, there's marriages are down. We see that as a trend in our society. And so maybe they started out and they had an amazing girlfriend that was just going to take care of them. Girlfriend gets burnt out, goes away, and then that patient no longer has a care partner to be with them. So this way they can go on the app, they can find somebody who's already done the training, and they just need to do that singular training by themselves. So there's a plethora of these care partners starting to be on there. Again, this was something we just really felt that would be such a help to that community. And then what we learned through that care partner vision and version of it was facilities are also in need of CCHTs. We know that you don't have to be a CCHT to begin working in the facility, but there's call-offs, there's turnover, there's burnout. Again, not everybody can work those 6 to 2, 2 to 10, 10 to 6 shifts. And so people need something that is more flexible. And so then we decided, okay, well, this is really good, because that is one of the things that our app has done amazingly well, is to garner all of the people that can visit, or excuse me, all of the people that can work. We do background checks. So all of them are background checked, both statewide, nationwide, and countywide. And that is something that, sometimes we don't even do as a facility. Normally facilities do it right there in that community and for that state. We do hold the health insurance. And so we hold the workers' comp insurance for the families and for the care providers. So if a care partner goes into that home and something happens, God forbid there's abuse or something of that sort, it is not the patient's homeowner's insurance that's going to take over. We host the workers' comp, and we have the liability insurance. So both of them are covered, both, the patient themselves, that person that's getting the care, and the care provider or the care partner is also covered. And that is something that we tell people, when you come through us, not only do we not have the overhead, but we have the insurances so that grandma, grandpa, in the case of dialysis, that person that is getting the dialysis isn't putting up their whole home at stake if this person hurts their back or falls on the ice, or whatever may happen. And on the flip side of that, if there ever is abuse or something of that nature, this liability is still covered. And that is one of the best things going through there. Again, when we go back to the overhead, one of the best things that does happen is that family can set their price and rate. So we only take 20% off of whatever it is. So if someone comes in and they say, I can afford $25 an hour, that's what I want to pay. We don't say, okay, great, $25 an hour. Now we have to bump it up to 26 because we're going to take that portion off the top. $25 an hour goes into the app. We take out what would be $4, and then that care partner gets paid the remainder. And so that is all that shows to them is, hey, this family, Hannah has posted a job and they need 3 days a week for 3 hours each time for the dialysis. And so Hannah doesn't go over her budget. That care partner knows exactly what they're going to be paid and the exact hours that they are needed.
I just have to say, that is so cool. It is the best blend of a private caregiver and having the license, the bonding, the protections of working with a company. And the other thing that I was talking with, I think we follow some of the same kind of folks. We were talking, I was mentioning you with Keith Edwards, if you remember Keith Edwards, and Michael Morales. I was talking with them a little bit about what you guys were doing as well, and where people can have this kind of support to come home at the same kind of price point that they're going to pay for having a caregiver come in. They can get your loved one. You can have some help getting started on dialysis. They can throw a load in the wash, prep a meal. I just think that's really, really innovative.
Thank you.
Definitely,
Thank you, really. Yeah.
definitely needs a need, and there really is a demand to help more people. I think more people would come home if they had, some help.
Yeah,
So,
quality of life is there, and I think that's a big deal right now. And being in the facility is so expensive, and we
yeah,
know that patients do better if they're at home, both obviously the comfort, but again, if you don't have a provider, or excuse me, a care partner or somebody that can even breaking down the boxes, something as simple as that we've realized is a big deal. You go and I don't know everybody here if they've had that experience. You go into this patient's house and you see this giant wall of just stuff that needs to go out, and you're like, and they're so overwhelmed. They're like, hey, I don't have the energy for that. I'm trying to manage. And then you've got the care partner who's in the home. Even if they have someone who is loving and adoring, that person is getting burnt out. Maybe they're managing outside of the home. They could be managing children, or they're managing their older loved ones. Now their husband or wife is having to be on dialysis 3 times a week, which we know is a job in and of itself. So that person has no respite. And that is like one of the things that you can just go on there and you can say, hey, I need some help. I mean, it's something
and,
phenomenal.
and
Easy.
and for the price point of a date night. That's
Exactly.
that's really phenomenal. So the other thing too, I was interested, while it's not covered by insurances yet, I can just see a time where I would think, no pressure for insurances out there, but I would think that they would figure out that there's some great savings in helping people come home. Just helping people come home, it shaves off 3 months of primary liability for the plan, in terms of their Medicare benefit. There's so many benefits to having people come home. So I just think it's phenomenal, but I wanted to open it up for the nursing team and see, what questions do you have for Veronica?
Yeah, please. And one of the things we're looking at too is looking into, you know, where is the need the most in specific areas. And if you want to be one of the places that you say, hey, I want to try this out again. It's kind of a no harm, no foul situation. If you try it out and you're like, oh, I didn't get a lot of caregivers in my area, or a lot of helpers as we call them, or there wasn't enough care partners, or something occurred that it wasn't that great. It's like, great, it's no sweat off your back. So if there is a area of the community, or within, even if you're like, we can't use this specifically in my facility or at my center, but we would like to use it for this other family, like, we can either do the referral based. You can even we just rolled out our promo codes where it can, maybe your promo code is Kimberly, and anybody that puts that in gets like 2 hours for free to try it out. And that's something that we can definitely do. But please, if there's something else. I know the RHA got a hold of me. The gentleman's name is Bill, and I can't remember his last name off the top of my head, but he said, there's a lot more than just DaVita and Fresenius. We have a huge network of small business dialysis operators that are really in need and can afford all of this full-time staffing, or, as we know, the turnover. You get 5 technicians trained and then they don't show up, right? When the shift starts, or they're like, oh, I left my lights on, and they never come back from turning off their lights. And so this way it's like, well, it didn't cost you anything. And if you really like them, again, we are no contracts. You really like that Jasmine worked out for you, you can keep her. That's not you're like, oh, I would like to hire Jasmine now because I am no longer, I know she's a great worker. She's been trained, and now I want to bring her onto the benefit side. But before that, we're hosting the workers' comp, and we're hosting the liability insurance. So again, it is a win-win for both situations. So please let me know if there is something that I can do to help in those areas. Alfredo joined us here. I'll do a really quick introduction of Alfredo. He is our territorial sales director, and so he goes around and talks to the different facilities and communities and things like that. And so he's also, somebody who can assist with those kinds of things. But anything on that end, we're happy to help out. But again, thank you, Kimberly, for having us, and we'll open it up to those questions.
Yeah, ask away. I know one question that came up in the chat was, is it only hemo, or is it hemo and PD? And I know you guys do both. But you don't do the training though, correct?
So the one thing we don't do is the training. but we do have resources to have them trained. But a lot of what we've dived into is getting the people who are already trained. The
Yeah.
ad is out there for care partners who don't have anyone that they're care partnering with anymore. They've either lost that loved one, or the story of the girlfriend and the boyfriend was actually, she broke up with him because it was just so much, and then she said, but I could do this for somebody else, so that's not an emotional attachment. And then aside from that, the CCHTs would already be CCHT certified. But when they go into, if it's a facility, they'll have to train on that specific facility's wants and desires.
Yeah. Yeah, that's all. I think it's such a fresh idea. It's this kind of common sense innovation that's really helping people live their best lives on dialysis, which, oh, that's what we're all about. Really, truly fantastic. Great questions so far. What other questions do you ladies have? Looks like Stephanie has some questions.
Yeah, I think I find it interesting looking into your website where it's not only related to dialysis and the assistance of that, but also just helping with different things, like errands I see and cooking and meal prepping, because sometimes that is a big part of, their lives too, where they're missing that assistance, and just having the availability to also be part of that. I think that's very innovative. I don't think there's anything like that. I think usually people have to hire two separate people for that.
Exactly. No, thank you, Stephanie. And I think in the beginning, we talked about the way that we actually started was we were senior helpers. And that's our branded name, was for the caregivers to be helpers. And it was task and chore oriented. And then we had just, people coming out being RNs. Hey, do you have anything for me? Because I can't work 6 to 2 every day, or 2 to 10, because I have kiddos and but I'm available with all my credentials from 8 to 3. And that's when we started partnering with just these more specialized care needs. But we do still always want to stay non-medical, if you will, even though we have the CNAs. We do the RD and the HHD. And so we have those, but again, they will be trained elsewhere. They're not trained from us, but we can link to trainings. We have a full software engineer team. Again, we're not an agency, we are a technology. And I always associate it, like I said, with Bumble and Uber, because it's you get to choose what you want. You get to go through and you get to see exactly who you want. If you're like, oh, I want, and I'll use myself, for example, if it's like, well, I want a Hispanic female because my mom only speaks Spanish and I want someone who can really give her that quality. And it's like, oh, well, here's a care partner who's done dialysis, it looks like, for other people, and they want to be with someone who speaks Spanish. Well, now they can go out and they can go shopping together too. And it's not just, oh, they only can do this, then I need a housekeeper to do this, and I need someone to help cook and do this. And so I think that we're trying to close and bridge that full care spectrum.
That's really fantastic. So, as we wrap up here, how do people, because we'll be sharing, how do people find you guys when they have questions and they want to know more? If they want to know, how do I add this to my benefit package for my plan members? How do people reach you?
Yeah, so just you can go on herewith.com. There's a form right on our website. Our dialysis landing page is what it's called, will be built out. But again, you can reach us directly. Kimberly, you have all my contact information. I'll also put it in the chat. Again, like I said, we can also reach out if Alfredo needs to go to a specific, if there's something they're like, hey, all these members are gathering here, we need to go talk about it in person. We're more than happy to do that. We have, we're really just kind of an open gamut right now, whether that's telephone, the Zoom calls, or being in person. We're happy to travel to where we need to travel to, because this is one of those things where I do believe, I've been with the company now almost 3 years. The company's been a company for 6 years. And I just think that there's such a passion. I've always been in healthcare. Actually, Kimberly live really close together, and I was the director of the psychiatric hospital there. So I've been in healthcare my entire life. I started out as an NA. I don't think CNAs were actually a thing back in the day when I was about 15 years old. And so I've done everything from wiping tushes to, being on the office side of things. And so it's a passion for me. And I think that this is life changing for a lot of people because it's affordable. And that's one of the biggest things, is that it is very affordable. And also people who care about other people, and it's a way to connect them, because they're not getting somebody, outside of their community. We're not having somebody come in who's like, oh, I'm kind of in this. This is Kimberly going to, care for Nancy's mom, because they live right next to each other in the same community. And so we're really helping out that rural population also, or people who otherwise wouldn't seek help. Now they can do it from the, swipe of their phone. And we are web-based, iOS and Android. So it sometimes it's a blend of both worlds, where it's really that health tech piece. But again, all for the people.
Ah, I just think it's delicious, and I know I've already been sharing you guys with some folks that I work with, some patients, and family members have been sharing. I think it's a great resource to let people know about who might need that kind of support. If they mention that, gosh, they would do home health, or they would do home dialysis, but they would need some help. I think it's a fantastic resource. So yeah. So, and Stephanie's asking about standard rates. Yeah. So it's a standard caregiver rate, market rate. And I just like Uber, right? The caregivers set that rate. The patient sets that rate with what they can afford.
The patient sets their rate themselves. So, I mean, the only guideline we have is that they have to come in at minimum wage. So and then, we have a full customer service center team that will call as soon as you register for the app, if you come in as a family. And I challenge everybody to do it. I'm happy to get feedback too of, hey, this is a little glitchy for me, or hey, this is confusing for me, because that's we have a UX team that'll take that into consideration and say, oh, if Stephanie had trouble coming on, well, so would patients then, or so would families. And so we would have to look at that. But when you come in, it'll say, hey, set your budget. And if you say, well, I know that I can do $25 an hour for 3 days a week, we only take 20% off of whatever the budget is. So when your ad goes live for caregivers to apply, they would only see $20 an hour. And that's what they would see. So, and we do have, like I said, we're nationwide. And so there is not a territory where we're not at. There is some places we haven't dove into, of course, but if Kimberly comes to me and says, hey, I have a patient and they're in, Yuma, Arizona, in the middle of nowhere, and there's like 5 people in the whole town, like, give me a week and we'll build out those caregivers within that area. Because it usually takes about a week for me to get 100 caregivers in every zip code that we open up. And that's what's been phenomenal and we didn't see that side of it happening, of any zip code we open up, caregivers they come in. And of course, we get about, I would say monthly, we get over 1,000 applications, but we only allow 400 to 500 in, because they do have to we vet them. Like I said, we run the nationwide, it's through Checker. So it's through a third party, not me being like, oh, I'm going to let her in, she's a friend. It goes through Checker. They do the nationwide search, they do the statewide search, and the countywide search. And that is even above what, like your local health and welfare would do. And we do that because our insurance is for the whole nation, and we want to make sure that these people are safe. And so going back to the actual cost portion of it is whatever they set. The only time we would interfere is if it was below minimum wage, or if it's like, well, you put the job ad for, because sometimes minimum wage is $7 an hour, you put the job ad for 10. If you put it for 15, you may get higher quality of people that are going to want to go to that job. And so sometimes that happens within those different areas. If you're in New York and you put something for 15, you're probably not going to get any applications, but they'll have to be at 25 to 30 an hour. Yeah, like oh my gosh, I know Boise is just, prices are ridiculous in Boise now. And so, yeah, I think that, each different zip code is going to have its own quirks, if you will. It's almost like its own personality takes place. But again, we're happy to dive in, and anywhere we're pretty innovative on the tech side. I do have an entire engineering team And so if something works for you and then we don't have it built and you're like, hey, this would work for me, we can do that integration with whatever it is that you have. And that's what makes us so ingenuitive is, like I said, we are a San Francisco based company. And so we're a technology team. And so that is what really sets us apart is, oh, we don't have it. You know, like, I have a ton of Legos. Let me build that for you. And so that's what really sets us apart.
I think it's awesome. So you can check them out Herewith, just like it sounds, Here with, herewith.com. Check them out and share. I think it's a fantastic, very common sense, innovative service that can really help improve the quality of people's lives across the country. So thank you for what you're doing and for spending time with us today. Much appreciated.
Thank you so much for having me, Kimberly. I appreciate it.
Okay.
Bye-bye.